The conduction system of the heart. No, not that heart. This heart. No, that's a tomato. This heart. God! The cardiac conduction system is a group of specialized cells in the heart walls that carry electric signal through the heart and cause it to contract. The electrical signal starts in the sinoatrial node, or SA node. This impulse travels through the atrial syncytium, which causes the left and right atria to contract. The impulse travels through the junctional fibers to the atrioventricular node, or AV node. The AV node delays the signal and sends it out to the AV bundle, located in the interventricular septum. The AV bundle separates into the right and left bundle branches, which then travel down to the apex. Once at the apex, they turn back up into the ventricles through the Purkinje fibers, which causes the ventricles to contract. The ventricles then relax, completing the cardiac cycle. The heart rate is slowed by the activation of the parasympathetic nervous system. The vagus nerve is the nerve which decreases the heart rate. If this nerve is damaged, it will cause the heart rate to speed up. This may result in tachycardia. Tachycardia is when the heart rate is faster than normal while you are at rest. It is detected on an EKG when the cardiac cycle is rapid, has irregular waves, and does not follow the normal cardiac cycle. The heart rate is accelerated by activation of the sympathetic nervous system. This happens by the activation of sympathetic receptors in the heart. If these receptors get blocked, the heart will slow down. This may result in a condition called bradycardia. Bradycardia is when the heart beats slower than normal in one or both chambers. It can be detected on an EKG when the cardiac cycle is too far spread out. Systemic circulation is the circulation of the blood around the body. This path begins with the blood in the left atrium. When the atria contract, the blood flows through the bicuspid valve into the left ventricle. From here, the blood passes through the atrial valve into the rest of the body. The blood is then returned to the right atrium of the heart via the superior and inferior vena cava. Flows through the body through a ductwork of blood vessels. Arteries carry oxygenated blood away from the heart. Veins carry deoxygenated blood back to the heart. And capillaries are where red blood cells exchange gases with the tissues of the body. Arteries have thick muscular walls to withstand the high pressures of blood being pumped directly from the heart. Veins have thin walls because of the lower blood pressure. Veins also have valves to stop the backflow of the blood that may result from the lower pressure. Capillaries are very thin vessels that form a latticework through the organs and tissues of the body to promote gas exchange. The muscular pumps are muscles that squeeze the blood back to the heart. Each contraction pushes the blood in the veins through their one-way valves. This pumping of the blood helps to increase venous return by promoting the movement of blood back toward the heart. There are two forms of muscular pumps, the respiratory pump and the skeletal muscle pump. The skeletal muscle pump acts from the contraction of muscles and squeezing of the veins, while the respiratory pump acts from the negative pressure in the thoracic cavity from inhalation that draws the blood towards it. The heart, being a muscle, needs its own supply of oxygen to contract. This oxygen supply comes from the coronary arteries. When the left ventricle contracts, pushing the blood through the aorta, The heart is the first muscle to receive the oxygen-rich blood. When the atria contract, blood from the right atrium flows through the tricuspid valve into the right ventricle. During ventricular contraction, blood flows out of the right ventricle through the pulmonary semilunar valve into the pulmonary artery and ends up in the lungs. The blood then exchanges carbon dioxide for oxygen through the capillaries and ovular sacs before being sent back into the left atrium through the pulmonary veins. Venous return is the amount of blood that returns to the heart after each cardiac cycle. There are two major factors that influence it: the blood pressure in the veins and the diameter of the veins. Pulmonary and peripheral congestion. Pulmonary congestion is where the left heart stops beating and the blood cannot leave the lungs. Peripheral congestion is where the right heart stops beating and the blood backs up in systemic circulation. Both forms of congestive heart failure cause edema and weakening of the heart if not treated. The treatment for these two conditions includes taking drugs that mimic the action of the parasympathetic nervous system and slow the heart rate down, which allows for more filling time, which leads to a stronger contraction. A myocardial infarction, in the most simple terms, is a blockage of blood flow to the heart. Blood is supplied to the heart through the coronary arteries. If one of the arteries becomes blocked, oxygen will not be supplied to the muscle tissue, leading to irreversible cell death. A myocardial infarction can be treated with a bypass surgery to supply blood past the blockage, or by placing a stent which will help open up the artery and allow the blood to pass through.